Can you imagine how valuable it would be if you had access to 13 of the world's most renowned experts when it comes to midlife and aging on every subject you can think of, like all the things that affect us as we're going through this season? I'm talking sexual health, your hormones. What about plastic surgery, skincare, friendships, transforming your body? What about nutrition, reinventing yourself, or manifesting the man of your dreams or the career that you always wanted to have? So I don't know if you know this, but I recently held an event called Camp BMore. And this is a dream that I had of bringing like the world's most renowned midlife experts, all females, and bring them all together in one room and give the women who need this information access to all these women at once. And my idea was, okay, I want these women all to come together and I want them to talk to us, not like a professional from the stage, but like talk to us the way you talk to your girlfriends, like shoot straight with us. And I wanted the women in the audience to be able to ask the questions the way you would your best friend. Like I wanted real conversations, not just about hormones. I mean, because those are some great conferences that I've attended, not just about, you know, how to age powerfully from a physical standpoint, but like mentally, how do you do that? Like, how do you really step into this next season and do all the things that have been on your bucket list? How do you overcome the self-doubt and the insecurities and the things that plague so many women after they reach a certain age? They start to feel invisible. They start to feel like their life is going downhill. They start thinking that they have to dress a certain way and act a certain way. But yet there are these women, you know them, you see them, and maybe you follow them online, and it just seems like they never struggled and they are thriving. And you see them and it either does one of two things. It either makes you jealous and it triggers something in you, and then you start feeling like, you know, I don't want to see that because it's like a mirror of what it is you want, but you're like, I don't even believe that that's possible. That's one reaction. It makes you feel more insecure, like you're doing something wrong. Or you see it and you're like inspired and you're like, okay, if it's possible for her, why can't I do that? Like, why couldn't I have that same transformation? Why couldn't I discover my career or write a best-selling book after the age of 50? If you are in that latter group, if you're someone who's like, why not me? Then you're in luck, because Camp BMore, although that event is over, we held it in Las Vegas the last weekend of April. We are going to do it again, by the way. And if you want to get on the wait list, the link is below in our show notes. But that event is over. But you don't need to have any FOMO, because I'm going to give you the cliff notes, the most important takeaways from each one of these experts. So in essence, it'll kind of be like you were there. Plus, I'm going to share with you, if you're watching this live on YouTube, I'm going to share with you clips from the event so you can actually see what it was like. You can see the women who were in the audience. You can see for yourself that you should have been there. You would have been welcome. You would have found your bestie. And next year you will. This was an event unlike any other. And when I spoke to the speakers, I said to them, listen, don't hold back. If you want to cuss, you can cuss. If you want to tell us something that normally your colleagues would judge you for, like, give it to us. Be honest, be real, be straight. And I limited each speaker to like 20 to 30 minutes because I wanted them to come to the stage and tell us the most important things, like what's going to make the biggest difference in our lives. Our first speaker was none other than Dr. Mary Claire Haver. Now, if you don't know who she is, you've been living under a rock, please make sure you follow this woman. She is making the biggest difference in the conversation around menopause and women's hormone health. She's pushing this conversation forward, and she's got a great book out. If you're interested in some of the things I'm going to share that she shared from the stage, I highly, highly recommend her book, The New Menopause. But here's the high-level takeaways from her time with us at Camp BMore. Number one, did you know that menopause is one day? Yeah. So technically, if you've gone 365 days without having a period, on the 365th day, you're in menopause. On day 366, you're postmenopausal. So most of us are postmenopausal, but we use the phrase, I'm in menopause. But once you're in menopause, you're in menopause forever. And every single woman will go through menopause at some point in her life. It is inevitable. It is not avoidable. What is avoidable is how you feel going through it and what it is you experience. So most women, as she explained, believe that they are, and most women actually do struggle with a myriad of just horrible symptoms. And you've probably been warned about these by your mom and your aunt, etc. And so you're dreading menopause. And that's why women in their 30s don't learn about perimenopause because we've so villainized this whole stage of our lives that it's like we have our fingers in our ears, and it's a shame because the earlier you know the things you should be doing, like in your mid-30s, the easier the transition is into menopause. And that transition is made far easier if you're making lifestyle choices and hormone replacement therapy, HRT. Some people refer to it as menopausal hormonal replacement therapy. HRT is what most is referred to most commonly. But again, you're in menopause after you've gone 1 year without your period. Perimenopause, get this, lasts between 7 and 10 years. So if you're a woman over age about 35 is when you can start to experience some of these perimenopausal symptoms. And there's about 40 of them. And your doctors don't know anything about this unless they've specifically been trained in this type of care. Even your OBGYNs, they're getting less training on menopause than most of the women who were in this audience. And I say that not to put anyone down or to discredit your doctor or your provider. I say that so that you know they probably don't. So they're very likely when you go in and you're complaining about your symptoms, etc., they're going to suggest that you get on an SSRI. They're going to suggest that you take an anti-anxiety medication. They're going to suggest that you take a sleeping medication or that you lose some weight. And they probably won't address the fact that you're in perimenopause. After a woman is age 35, roughly, the hormones begin to decline. Progesterone, estrogen, and testosterone. Your hormones are responsible for every single action of your body. Your hormones are responsible for the way you look, the way you think, your skin, your vision, your joint health, your bone health, your muscles. I mean, freaking everything. Everything is controlled by your hormones. So imagine if the most important fuel that you have, the most important function of your body is slowly starting to decline. And you're going to your doctor and they're like, well, hey, maybe you should take a sleeping pill. Like, it's just not helpful. So it's so critical that you do find a clinician who understands your hormones. And it's very important that you understand that you're going to age powerfully the earlier you start hormone replacement therapy, number one. Number two, it is never too late. If you are 65 years old and you're watching this, if you're 75 years old and you're watching this, girlfriend, it is not too late. Now, the way that a clinician would treat you is probably differently than they might treat me. I'm 56, but it's never too late. And there's so many benefits for you, things that are going to help you to feel better, more like yourself. And I think so often we don't even know that we don't feel good because we've just dealt with it for so long. One of the things she said is that it's very important that your doctors diagnose you by looking at two different things, blood tests and symptoms. And it's very important that doctors look at both of these things because blood work alone doesn't take into consideration that every woman feels different. So like my blood work might say that my estrogen is normal, quote, normal, but yet I don't feel good. And I'm having all these symptoms. I'm having hot flashes. And so a well-trained clinician, someone who's trained in menopausal care, is going to recognize you need to look at both of those things. That was, I think, probably one of the most important takeaways. And I know what you're thinking right now, like, okay, where do I find a clinician who actually understands menopausal care and accepts insurance? Ask around, ask your friends if they're working with someone specifically who has menopausal training. If you're looking for a virtual health solution, I highly recommend MIDI Health. They are a regular sponsor of the show, and I asked them to sponsor the show, I'm telling you right now, because until I heard about them, when someone would say, like, where do I find a doctor that has menopausal, training and accepts insurance, I would be like, I don't know. Try Yelp. You know what I mean? And then I learned about MIDI. I'm like, I have to have them as a sponsor of the show. So that is one option for you. And they are available in all 50 states. That's one option for you. And again, you still can ask around, but just know clinicians are humans. So you've got to find the right fit and don't be afraid. In fact, don't be afraid. Be certain that you go to your clinician with the right information in hand, that you know what questions you want to ask, that you're going to ask for the blood work, and that you're going to be informed about perimenopause and menopause, because estrogen is going to make you age more powerfully. Estrogen is protective. It's protective of our brain, our bones. It lowers your risk of heart disease, of dementia, diabetes, osteoporosis, even suicide. The epidemic of women who struggle with anxiety and depression it's criminal, because so much of this could be helped if women were getting proper care. So I was really excited to have her on the stage. She also talked about weight gain for menopausal women. It is not in your head. The weight gain that women experience in menopause and through that transition of perimenopause is very different. They put on what's known as visceral fat. And visceral fat is the fat that wraps itself around our organs. And this fat is very resistant to all the things that used to work. So if you're someone who it used to be very easy for you to drop the weight, drop the body fat. Now you're like, what is going on? I'm doing all the same things and I just can't get off this weight in my midsection. You notice, you can feel like, okay, I'm putting on back fat and where my body is holding on to fat is different today. That is not in your head. That is because when hormones go out the door, hormones, specifically estrogen, she's like the Beyonce of all the hormones, and she tells the body what to do with our body fat. Estrogen is protective. And so as that's leaving, the body's like, oh, estrogen's leaving? Well, we know another hormone that's protective, cortisol. Let's ramp up cortisol and let's store body fat around the midsection because that's a protective area. But if we can get your hormones in balance, it's much easier to lose that visceral fat, and reducing your cortisol, leveling out your estrogen, getting the right balance of progesterone, estrogen, and testosterone is key. I also love that she said it is so important that you work with a clinician who truly has menopausal training, because so many women have been told that they are not candidates for HRT. Did you hear what I just said? If you're someone who was just about to comment below this video, below this episode, what if you're not a candidate for HRT? She will say to you, first, triple check and make sure that who you heard that from has looked at the most recent research and that you truly are not a candidate. She talked about nutrition and said that it's really important that women prioritize protein, specifically about 1.6 grams per kilogram of lean body mass. Focus on fiber, about 25 grams of fiber per day, and limit added sugars, obviously. And try to stick to a diet that's anti-inflammatory. These are things that I've covered in other episodes, but it was so great to hear that from her. She also talked about how important it is that we make some changes in our healthcare community. But right now, you've got to tap into the women, the experts who are helping to spread the word, because these things usually take about 20 years before they reach the medical community. The next doctor that we heard from was Dr. Kathleen Jordan. Dr. Kathleen Jordan spoke to the audience about GLP-1s. But hold up. I know you're like, wait, Chalene, you're like a fitness and health person. What are you doing having somebody talking about GLP-1s? GLP-1 is a hormone. We've just villainized it because of the way Ozempic and Wegovy were portrayed in the media. But this is a drug that has been studied far longer than most people realize. Currently, 1 in 8 Americans are using a GLP-1, but more often than not, it is specifically for weight loss. Dr. Jordan spoke to the audience about how GLP-1s can be used by midlife women in microdoses. So not your typical dosage that's making people lose tons of muscle, lose their appetite, and have all these negative side effects. A microdose, and she shared with us some of the research on how it helps to, first of all, there are far fewer side effects, but huge benefits, fewer strokes. The research now that's emerging on microdosing a GLP-1 in the prevention of dementia and cognitive decline, improved liver health, better sleep, the reduction of systemic inflammation. And ladies, you know, this is such a huge struggle for so many women. They just feel puffy and inflamed. And they're like, I don't have 10 or 15 pounds to lose. Or maybe that's all I have is 10 or 15 pounds to lose. I don't have 100 pounds to lose. I don't have 50 pounds to lose. I'm not diabetic. I'm not even pre-diabetic. So is a GLP-1 even something I should consider? Again, this is a tool. It's not an automatic fix. And she was adamant about saying so many people consider a GLP-1 cheating, which is so weird because it's a hormone. And if that hormone's in decline, just like estrogen, we wouldn't say if a woman's supplementing her estrogen that she was cheating. So, and the reason why people are calling it cheating is because many women have had success that they couldn't otherwise have because of hormones. So we have to kind of look at this as a tool, and we need to frame it a little differently. And we have to remember that there are nuanced ways for clinicians to prescribe a GLP-1 that might help you not necessarily even lose weight. You might be watching this and you're like, it's not that I need to lose weight, but maybe you're not a candidate for estrogen because of a type of breast cancer that you are a survivor of. And you are looking at ways to protect your brain, and you can't use estrogen to do that. You can't use estrogen to protect your bones or to reduce inflammation, but you may be a candidate for a microdose of a GLP-1. And this is a really remarkable way that many women have found they've been able to just lose the last 5 to 10 pounds and be on such a low dose that there's a far fewer side effects. And she also talked about the belief that GLP-1s cause cancer. And, there just isn't any research to suggest that that is true here in the United States for humans. So I think it's something to consider. She did say that GLP-1s, when you're microdosing them, that doesn't mean like just giving yourself a little bit of Wegovy or a little bit of Ozempic. Those are pre-loaded pens. And what she's talking about is taking the GLP hormone and having it compounded by a compound pharmacy and working with a clinician who is accustomed to helping and treating people with this particular hormone. So it's a tool. So if it's something you've been struggling with, if you just cannot bring your A1C down, if you cannot bring your cortisol levels down, if you're struggling to lose that 5 to 10 pounds, you're struggling to bring your inflammation down, it's a conversation you should have with your clinician. And by the way, Dr. Kathleen Jordan is with MIDI Health, which is one of our sponsors for today's, coincidentally, one of our sponsors. You can check out MIDI Health. Just go to Chalene.com/MIDI. It's spelled MIDI. I use MIDI myself. In fact, if you saw the episode that I did where I talked about using estrogen cream on your face, we'll talk about that in a moment. I get mine from MIDI Health. You can get your hormones. You can find a clinician who can help you maybe consider doing a GLP-1. Next up, we were talking about solutions for thinning hair. Now, I've done some previous episodes on different ways that you can treat thinning hair with red light therapy, which serums and topical treatments are actually effective. If you missed that episode, check it out. I'll link to it below. I had an exceptional doctor on, Dr. Dray, who's like one of my favorite YouTubers. And she went through like all of the popular things like hair vitamins and gummies and biotin and red light therapy. And we went over those types of treatments to improve your hair, to make your hair thicker. But for a lot of women, it's like, yeah, it's a little bit thicker, but it still sucks. And I don't feel cute. And I don't feel feminine. And I just want my thick, gorgeous hair. Or maybe you never had thick, gorgeous hair. You know what I'm saying? And now that you're getting older, you're like, it's even worse. You start to notice your hair is getting thinner. And it's just not fun. It's not cute. Ladies, like, we define ourselves through our hair. And I've done a previous episode talking about all the different solutions to make your hair thicker, like red light therapy, gummies, capsules, serums, like shampoos, all those things. That episode was with Dr. Dray, and I will link to it below this episode. But if you're someone who's like, I've done that. I bought the dumb things. I tried all the topical stuff, and yeah, it helped a little bit, but my hair is still lame. You're going to love this, because Jess Halleck came and said, okay, if you just, it's not working, or it's not giving you enough hair and you want a solution that isn't extensions, I mean, because obviously extensions are fun, said me, but they damage your hair. Like, there's no way around it. I don't care what you say. They all damage your hair to some extent, and it's expensive, and it's very timely. So she came to us with a solution that actually addresses the top of the head, because extensions don't do that really. So she showed us different ways of finding a topper. And there's a whole variety now of toppers. Like, there's these mini toppers and bang toppers and an improved version of the halo. So maybe you've tried a halo before. Oh my gosh, they're so much better now. And she did this transformation on stage, showing women how easy this is. And it's a simple solution that incorporates your own hair, very affordable, especially when you consider how much extensions are. And then she shared with us, how do you, like, these toppers are sold online. I've seen them on TikTok. I've seen them, on Instagram. I've seen them on Amazon. But how do you buy a good one? How do you match one perfectly? And the answer to that is you've got to go with a company where they're actually customizing it. Otherwise, you're probably going to waste your money. And you want a hair topper, like she suggests that you start with like a mini topper. It's really small, and it just basically covers like the top of your hairline, like where your part would normally be thinning, and the rest of it is your hair. It makes such a huge difference. In fact, I got one for my mom for Mother's Day. She doesn't have it yet, or I would show it to you. But I can't wait for her to have it. My girlfriend, Jen, she was the transformation that we did on stage. She said, I am home now. I cannot believe how much this topper has transformed my confidence. By the way, I will list below this episode each one of these women's Instagram handles and how you can get in touch with them if you're like, oh, I want to learn more. Next up was April Franks. And April was there to help us understand that you have got to stop playing small and thinking that you deserve less or that your time is over or your best years are behind you. And she taught something called the Bay method. And it's a way of transforming the way you think and the way you behave so that you can have the things that you want. But it really does start with a mindset. So here's the Bay method. So the first thing you have to do is you have to think about what it is you want and what is the woman like who has that? And then you just need to become her. You just need to be like, that's who I am. You just need to decide like, not that's who I want to be. You have to say, that's who I am, and start behaving as if you are her. The A in her Bay method refers to aligning. She says, you have to align everything with who it is and what it is you want. That means your habits, the way that you speak, the way that you talk, the people that you're around, and the things that you believe are possible. Like your actions really need to be in alignment with what it is you want. And the E of the Bay method stands for expanding. And it's like a way of evolving and realizing like there are things that you do and believe that are holding you back. And she shared specifically how, she says like, I've always had like a very kind of masculine energy. And because of that, I would attract men and I would try to out alpha them. And I never would allow them to kind of be the caretaker. And because of that, I was always angry at men because I was a caretaker. And she said, I had to evolve. I had to expand. I had to make room and realize like if I want to be cared for, I have to allow someone to care for me. I have to allow that. So she had to expand to make that possible. She also said that confidence, I love this, is built through healing. Heal your traumas. Do the work. No matter how old you are. I don't care if you're 65 or 75 years old. If there's unresolved trauma, it's going to impact the way you view yourself and the world. It's going to change your confidence and give you clarity if you heal your traumas. Next up was Sonia Ramos, and she is a super well-known influencer on TikTok. She's over 45. She basically was working at a weed dispensary or like a weed farm as, with all these young kids and always enjoyed makeup, etc. And during COVID, she just took to TikTok and started talking about skincare and makeup and completely reinvented herself. And left an unpleasant marriage, found her own thing, became like one of the most well-known midlife beauty influencers. And she talks about how she you just got to step into that space and stop believing that you're too old or that whatever it is you want to do is for younger people or for people who look a certain way. And you have to stop caring what other people think. Like you've got one shot at this life. So you can't worry about what other people think because all that's going to do is hold you back. And the only person who it's going to hurt is you. Like, don't listen to what other people have to say. Put yourself out there and keep putting yourself out there. And don't listen to that little voice in your head. Don't allow what you think people are going to say to hold you back. And she just basically shared how if she had done that, she wouldn't have been able to show up for women the way that she has. She's now, bought her own home and moved to LA and has these incredible brand deals. And none of that would have been possible if she had allowed that little voice in her head that says, someone's going to think you're too old, you're too this, you're too that. And it's just not true. She also shared with us some of her favorite tips for midlife women. Just basically the importance of you don't have to be like Chalene and wear a ton of makeup. Y'all know I'm a housewife hooker. I love all the glam. I love all the extra. I'm so extra. I love it. It's a hobby. Some women go to Michael's and buy things to craft. I go to Sephora and I craft with my face. I love all the makeup. But Sonia was saying she doesn't. Instead, but she's like, if you're a woman who doesn't want to wear a lot of makeup, you don't have to. You don't have to do that. But girl, you better take care of your skin. Sunscreen, sunscreen, sunscreen. And if you are going to wear just a little bit of makeup, wear a lip. And if you're going to wear lip color, ladies, as we age, probably you should stick with fewer powders and more, what are they called? Cream-based was one of her big tips. And to apply your blush and contour just a little bit higher than where we used to put it. But basically she just really wants women to know you don't have to wear makeup because somebody else does. If you don't feel comfortable in it, then don't wear it, but do take care of your skin. Gala darling, I love her. Her message was that you feeling good is your responsibility, no one else's. It's yours. And you need to make it your job. And there are certain things that you can do every single day that are going to make you feel better. And when you feel better, you're going to feel better. You're going to treat other people better. More amazing things are going to be coming your way. You're going to attract them into your life. She also shared with us a technique called EFT tapping. And it kind of works a little bit like EMDR therapy. Someone's going to say it no, it doesn't. For me, that's how I would describe it. It's a technique of tapping on different points on your body. As you can see in the video here, the audience was tapping along with her. And it's a way to relieve stress. And you tap on these specific points on basically your face and your body while you're acknowledging how you feel, but also recognizing and voicing how it is you want to feel. So it might be saying things like, even though I'm overwhelmed, I also know that I'm powerful and I accept myself. So you're acknowledging what it is you feel, but you're also addressing what it is you want to feel. It calms the nervous system, it lowers your heart rate, and it just makes you feel good. Makes you feel really happy. She also talked about why you need to think about the thing that's weird about you as the thing that's probably the most magnetic thing about you. Okay, Gala darling, first of all, this woman only wears 2 colors, pink and purple. That's it. Her whole house is pink and purple. Why not? She drives a pink car. She wears a pink hat. Everything is pink and purple. Her hair is pink. Why not? Who cares what other people think? She's whimsical. She's playful. She's basically turned her weirdness into a wow factor. And it's attracted all the things about her that she used to be embarrassed. She used to get teased about. She's like, now it's what attracts other people to me. And she talked about how important it is to rewire your limiting beliefs and to start your day every single day by doing something that's really joyful for you. Have a joy practice so that the way you start your day isn't by scrolling on your phone or just drinking coffee and going about whatever it is you need to do on your laptop or on your phone, but have a joy practice, whether that's reading scripture or putting on music and dancing or giving, journaling or doing some tapping. But practicing joy without apologizing is really the key to happiness. And you don't have to worry what other people think. I mean, that was a universal theme on this particular day, is stop worrying what other people think. I mean, look at the way I was dressed. I mean, the way I dressed for this event was intentional. I wanted women to be entertained. You don't need to be that extra, but I want to be that extra for you and show you that I don't care what other people think. I really do not. I don't care if people have a problem with me crawling on a table or using cuss words or the F word. I'm a grown-ass woman. I don't care what you think. You don't pay my mortgage. I don't need to care. I'm too grown to care. I'm too wise to care. I want to live my best life. I want to do things that make me happy. I want to dance. I can listen to exactly 2 speakers, which we did at this event, 2 speakers, and then I need to get up and dance. I can't sit still for that long. It's painful. It's torturous. But if I can dance and have fun and with my girls and not worry what anybody else thinks, and I can wear a short skirt and high heels and big hair and all the things and glitter and glitz, and that doesn't necessarily have to be your thing. I have lots of friends who don't do that, but they appreciate that I love it. And that was kind of the theme that I wanted every woman to take away from this event is like, unless someone's paying your mortgage and has, like, you have a debt of, I don't know what to them, who cares what other people think? In particular, strangers. Alicia Erickson wanted every woman to know, no matter where you are, whether you are 65 or 45, you can transform your physique with muscle. And the way that you're going to do that is by deciding and committing and learning everything you need to know. It's not just like, okay, I need to exercise 5 days a week or I need to lift weights. It's about muscle. Muscle is your fountain of youth. And in order to create that kind of muscle, you have to lift heavy. So Alicia shared with us her journey, which started around age 49. And it started when she realized that her kids were gone. She was going to be an empty nester, and she was looking at her body, looking at her health and going like, I need to change some things. And she just made that commitment to doing and developing all new habits, understanding that in order to look different, she needed to behave different. She started strength training 5 days a week and learning how to apply progressive overload. Progressive overload is something that we teach in Phase It. All of my workouts in Phase It are designed around progressive overload. What does that mean? Progressive overload means that you are every 6 to 8 weeks, you're doing a new program that's a little tougher and makes you a little bit stronger, a little bit better. So progressive, it's a fancy way of just saying like you're progressively getting stronger. And you have the potential to do that at 49, at 59. The same way you did at 29. But now it's even more important because muscle is what helps you to have a shape, to have confidence, to have mobility, to have strength. And strength is essential as we age. It's essential for your metabolism. She also created this transformation by moving into counting her macros. So today she says she eats intuitively, but she recommended that every woman learn how to track her macros so that you know the right percentage of protein, fat, and carbohydrates in order to reduce your body fat, in order to grow muscle, because your body needs a lot more protein in this stage than at any other time in your life. Again, about 1.1 grams of protein per pound per kilogram, depending on who you're listening to, of lean body mass, okay? So it's focusing on eating a high protein diet and understanding that lifting heavy is the key. And also, like when we talk about reps and sets, all of these things, you want to work with an expert who can help you to design and follow a program. Her recommendation was stick to one program. Instead of like bouncing around doing all these different workouts you see on Instagram or wherever, like stick to one program, follow that program for 6 to 8 weeks and go hard. She said, like, her quote was, lock it in. Like, don't go to the gym or, work out at home and scroll on your phone. Like, go freaking hard. Turn off your notifications on your phone and get serious about this. The biggest transformation, she said, also happened when she decided to give up alcohol, which then resulted in a addiction to sugar. And then she said she applied the same principles that she used to drop the alcohol to drop the sugar. So I loved that. Her transformation, she said, she's never felt more confident. This is a woman who had never felt confident in a bikini or lifting weights with, young guys at the gym and keeping up with them. And I would say the most inspirational part of Alicia's story is how it transformed not just her body, but her confidence. Next up was Natalie Jill, who talked about why nutrition is so complicated in this stage of our lives. And she really made it very simple. Some very simple, basic rules that every woman needs to follow. First, And most importantly, that we're all different. So what works for one person might not work for another, but there are some foundations which are universal, and they are to unprocess your diet. Unprocess your diet is really important, and fix your gut health. So when it comes to midlife women, we lose our body's ability to absorb a lot of the nutrients that we're eating due to poor gut health. It just happens because of the hormones, right? And so that's why it is so important that you are considering supplementing, even if you think you're eating a perfect diet. Even if you are eating like liver and spinach all day long, you're probably not absorbing those nutrients. So it is really important to make sure you have proper digestive enzymes. Natalie often talks about taking a digestive enzyme with every meal. And so, in fact, she told me about the digestive enzyme she takes called Mazymes, and it's from Bioptimizer. I will link to it below in our show notes. But she said, you got to fix your gut health because, even if you're eating well, you want to be able to absorb those things. Eat real food. Start with high proteins and then stop grazing. The grazing is what elevates our blood sugar levels. The grazing is what adds on all those extra calories. And while fasting might work for some women, what's more important is that we go longer periods between our meals and we stop snacking. And that just seems like a really simple way. I love that piece of advice from her. This is a simple way to create a deficit without having to go on a diet. Like, just, are you really hungry or are you just bored? Love that. She also said, if you are going to consider fasting, maybe start with a 12 to 16 hour fast, which is really simple to do. You basically go to sleep. There's 8 hours of it. Wait a couple of hours before you have your first meal. Pretty simple stuff. Other universals: limit grains, limit dairy, and again, same message here, limit sugar intake. And remember, sugar intake isn't like putting sugar in your cereal. Sugar intake comes in the form of very high carbohydrate, simple carbohydrates. Our sugar intake comes from alcohol. Sugars are in so many of our coffee drinks. So just for maybe a couple weeks, take note of how much sugar is in each one of your meals and track it. Because if you can stay under 25 to 35 grams of sugar a day, you're going to do wonders for your physique. In terms of supplements, Natalie suggested minerals, of course, gut enzymes, vitamin D, probiotics, creatine, and of course, I'm going to throw magnesium in there. I mean, magnesium is a must. It's responsible for over 300 different hormonal functions in our body. Did we say omega-3? Yeah, omega-3 as well. So those are your key supplements. Next up was Dr. Vonda Wright, a renowned female orthopedic surgeon who was there to help us understand that bone health is muscle health. Like, without your bones, you're just a heap of flesh. Like, your body looks good because your bones look good. And most women don't realize that due to those nutritional deficiencies and the declining hormones, you likely have far weaker bones than you realize. And she shared with us so many stories of women who lose bone mass and don't realize it. And they live this like young, vibrant life. And then before they know it, they have osteoporosis, they're breaking their bones. And 50% of women who fracture a hip will die. Not from the fractured hip, but from the complications of being immobile, being in a bed. So we've got to take our bone health very serious. Here was our number one takeaway: get yourself a DEXA scan. So a DEXA scan is something you can get probably at your local hospital. You can ask your doctor to prescribe a DEXA scan for you. Every single woman over 45 should be doing a DEXA scan at least once a year. You're also going to know your body fat percentage and what's going on with your bones. This is essential. You're going to do your mammogram and your DEXA scan. You should do that once a year. In addition to that, how can you increase your bone density without supplementation? Obviously, supplementation is great. You want to focus on magnesium, but she said jumping. So she talks specifically about jump training, and it's critical for bone health because she says it's you're like pounding the bones, and the bones respond by remodeling and making them stronger. It stimulates bone growth. So jumping can be done by like jumping rope for just a few minutes a day, or 50 jumps per day. Just like I'm jumping on one leg. 50 jumps per day per leg is going to dramatically increase your bone density. Guess what else? Wearing a weighted vest. I love my weight. So you can see I was wearing a weighted vest on stage. That's me trying to be a pink Power Ranger. Please, let's not talk about my hair. It was so big, it's embarrassing. I look like a cross between Toddlers and Tiara mixed with Dolly Parton and throw in a dash of Charo. I was going for Sabrina Carpenter. Didn't work out that way. The hair was so big. I was so flammable with my hairspray. But what I'm wearing there is a weighted vest, and it's a petite weighted vest. So if you're someone who's like, you have a really small upper body or you're a petite woman, I will link to a regular size vest and a petite vest below in my show notes. But wearing a weighted vest, there's 20 years worth of research to show that it improves bone density. She said jumping is the key. But if you can't jump, then wear a weighted vest, and it is never too late because your body will respond to training at any age. She also talked about doing short sprints. So even like 10 to 20 seconds, the body responds to that and improves bone density. And bone density is so important as we age. Next up was Susan Bratton. Whew, we were not ready. We were just not ready. Or maybe we were. The audience went berserk. It was so fun. Susan shared with us all the things that women really, in our generation, talking about sex was a no-no. You just didn't talk about it, right? You just didn't talk about it. You didn't talk about it with your girlfriends. You certainly didn't talk about it with your man. And because of that, a lot of women in our age group don't even know how their bodies work, and neither do your significant others. And so she went through a whole breakdown of how all of your female parts work. And I want to make sure I don't get banned here on YouTube. But here's one really important takeaway, and you've got to help your man understand this. A man can get aroused with, you take off your bra, and he's like, okay, let's go. For a woman, it takes a minimum of 20 minutes for her to get aroused, just to get in the mood. So it's really important your husband, your man, your partner, whoever it is you're with, understands they need to go much slower and avoid the regions that they normally go straight to. They need to avoid those regions for a period of time so that she's her brain can be elsewhere. She also talked about how important it is that female desire it's responsive. It's not instant. In other words, she has to be out of her head, and that takes time. And it needs to be something that happens all day, like flirtatious messages. And just if your man understands everything needs to go slower, then everything's going to work out better for him. She also talked about what it actually takes to have an orgasm, and that having an orgasm for many women, they don't realize is something you can learn how to do. And that it's really hard, almost impossible for most women to have an orgasm through penetration, that there has to be clitoral stimulation. And so we have to stop being embarrassed to talk about toys. It's it's not that big of a deal. And she gave away toys on the stage. It was like Oprah was there giving away new cars. I mean, these women went berserk. They were on their chairs. They were climbing over each other. They were screaming. They were jumping. They were ravenous. We were dying. It was one of the funniest things I've ever seen at a conference. So apparently this is a topic we need to spend more time on. She talked about blood flow and what it takes for a woman to get fully engorged, and what that looks like and what it takes, and also how to boost your sex health through proper nutrition, which I really appreciated. And then she talked about different ways to communicate these things to your significant other, especially if it's it feels like a taboo subject. I've had Susan on the show before, so I'm going to link to that previous episode. If you missed it, go back and listen. The woman knows her stuff. Then we have Melinda Farina on there. She talked to us about having the courage to just, if you want to have plastic surgery, don't worry what anybody else thinks about it. We're so weird about this. Stop judging other women. If they want to do it, that's their choice. And if you want to do it, it's nobody else's business. But if you are going to do it, here's some things that she wanted you to know. You must choose a surgeon only after meeting with a few of them. not just one. And don't assume that because somebody has a large social media following that they're actually the best, because typically it means that they're going to be higher priced. She talked about how it's so important to find the right surgeon who meets your needs in terms of the aesthetic that they create, and also the skin type and where they live. And there's so many other factors. And obviously, I think it goes without saying, she is a plastic surgery patient advocate. That means the doctors don't pay her. So I'm just going to say this on her behalf. Melinda is is the only person I would go to help me find the right surgeon. I mean, if you're going to go under the knife, I can't think of anything that's more intimate than someone like literally being inside of your body. They hold your life in their hands. Spend the money to get a consultation with somebody who's going to be your advocate. Someone who the doctors know if she's referred them to you, they know like if they mess up, their reputation is done. You know what I'm saying? So like I can't recommend her enough. And I know there's a long wait list, but maybe you can find another plastic surgery advocate. I don't know, but she's also got consultants that work for her. And I just can't say enough things about it, but like just follow her so that you understand like all the things you need to know if you are considering doing a surgery. Oh, here's one more thing. She said, you deserve to ask for exactly what it is you want, and that you should feel very comfortable, very safe, and like your doctor has exceptional bedside manner, that they're listening to you. You should know everything and have every question answered before you consider the surgery. And you always want to go into surgery as healthy as possible. That means you want to stop smoking, you want to stop drinking if you can, and you want to make sure that your immune system is nice and strong before considering any surgical procedure. Next up was Dr. K, Beauty by Dr. K, who talked about how important aging and having beautiful skin needs to start early. That it's about prioritizing your health. Like, because all the skincare in the world is not going to fix skin that's lacking collagen in your diet. She talked about how important collagen support is. Like this is a plastic surgeon who's saying, ladies, you need to be taking a collagen supplement at this stage. She said surgery is great. Here's what she did say: fillers, Botox, lasers, etc. They work to a point, but they're only as good as your injector. She did talk about the different types of fillers, talking about them restoring volume. She said you do lose volume in your face as we age, but if we're filling things up, if you think about it, when you stand in front of a mirror, what most people do is they pull things back. We don't like plump up our face, even though we are losing volume. So it is safe if it's done well. And most, even bad fillers, are reversible. But she said specifically, like doing fillers at the temples can often give somebody a lifted eye lift. But she did say that one of the easiest surgeries that she recommends for anyone who feels like their eyes are getting really heavy is the blephara. Like, so doing a blepharoplasty under eye or over eye. She says it's a super simple procedure. Melinda Farina said the same thing. And then we did a plastic surgery panel, and we had a bunch of experts and also just women from other speakers who've had plastic surgery who are willing to go on stage and share with us their experience. And all of them said a blepharoplasty, which I have not done, but I'm going to do one. I just had a consultation, and they said it's so easy. And it's just like one of those things that just makes you feel like brighter and lighter and just lifts the eye. Dr. K did say that at a certain point, if you realize like your face feels like it's falling forward, like filling it up just makes it look puffy and inflamed. And it's expensive if you're going to a really, well-established filler or injector, I guess they call them. So you might consider doing a lower facelift. And if you're going to do a lower facelift, again, get a consultation, because you want to make sure you're going to a doctor who's like absolutely the perfect fit. It's your face. Spend that money. Go see Melinda. That's my 2 cents. And our last speaker was Mindy Lawhorn, who spoke about midlife grief. And grief can come in the form of losing a child, losing a sister, losing a best friend, or losing your partner. In her case, she lost her best friend and her sister. I mean, it's one and the same, Renata. And then shortly thereafter, her husband, the love of her life, passed away from cancer, Lee. And she talked about how grief isn't just death. Like, grief is loss. You might be grieving the loss of your identity because now you're an empty nester. You might be grieving the loss of your marriage because now you're divorced. Maybe you're grieving a friend who hasn't passed away, but the relationship is dead. And how important it is to actually allow yourself to feel the waves of that and not to push it down and resist it. And that loss, grief, it doesn't define who we are. It can actually refine you. I love that her message was that you should never waste the struggle. And just watching women in the audience kind of like tearing up for whatever reason, like thinking about the loss and the grief that they have experienced and how she asked the audience, is there something horrific that you've been through that you now realize there's so many blessings in it? And you might not feel that when you're in the middle of it, but that loss helps us to grow. And it often helps others, and it helps us to realize we had a strength we didn't realize we had. But that grief is often unexpected. It's relentless. It can be isolating. But the best way to cope with it is by surrounding yourself with great people and giving yourself permission to be happy again, and permission to be sad when you need to be sad, and permission to tell people what it is you do want them to say and you don't want them to say, and permission to do something fun for yourself. She talked about scheduling her own procedure, shall we say, and how she decided, she kept like struggling in her head, like, is this appropriate to do right now? And when you're in that grief, she said, it really does take a toll on your health, and why it is so important to focus and prioritize your health because you deserve it. And of course, yours truly was there speaking, but the topics that I covered, I have to tell you, I've covered them on the Chalene Show. I talked about Zone 2 cardio, and I talked about friendship. And that topic on friendship really resonated with women because I gave them specific things to do. Like, not the cheesy stuff you hear in dumb podcasts where you're like, nobody does that. I'm not going to do that. That's so dumb. Oh my God, awkward. I really wanted to share with them specific strategies that I've used and my friends have used, because making friends in this season it's hard. It's difficult. It's challenging. It's a skill. So next week, make sure you're subscribed, will you? Because next week, I'm going to break it all down for you. I'm going to share with you exactly why you need to focus on friends. And I've got a surprise for you. It's going to blow your mind when you understand how friendship and connections impacts your health and your longevity. We've got Harvard studies to prove it. And I'm going to give you specific strategies to help you make better connections. And as always, if you want to spend more time with me, I would love to invite you to join me on Patreon. They usually have like a 7-day free trial, and that's fun. You can binge my past episodes. It's where I spill like the TT, like the stuff where like I can't even talk about it on the regular show because I always worry like, okay, what is someone going to think? I don't worry about it when I'm on Patreon. So if you want somebody to keep you company, head on over to patreon.com/The Chalene Show. Hey, thank you so much for subscribing wherever it is you listen to The Chalene Show. Don't forget that the YouTube video comes out on Sunday. So if you haven't already, head over there and make sure you subscribe. Click the notification bell so you never miss a new episode. I love you. I mean it. And I'll talk to you soon. Bye.